most important factor in the data analysis is that nurses report spending less time at the bedside than they desire because of the amount of time spent charting. This can negatively affect patient safety and outcomes. It may decrease patient satisfaction because the nurse may not be available when he or she desires or is in need, and the nurse may also be late administering medications or performing patient care tasks as a result of the amount of time spent charting. Case for the proposal. With increasing technology in healthcare, non-computerized charting is inefficient and time-consuming. Technological advances in computerized charting can allow the nurse to chart more accurately, efficiently, and in a timely manner, allowing the nurse to spend more time at the bedside. When the nurse is able to spend more time at the bedside with the patients, patient safety, positive outcomes, and patient satisfaction increases. Diagnostic statement. Inefficient charting system related to a non-computerized flow sheet as evidenced by surveyed nurses report of spending on average 3.2 hours charting per shift, staying late after their shift has ended to complete charting, spending less time than desired at the patient's bedside performing nursing care and tasks, an increased risk for negative patient outcomes, and decreased patient safety. The terminal goals include that the Women's Center nurses will effectively utilize the implemented computerized charting system as evidenced by compliance, completion, and accuracy revealed during chart audits. Nurses will complete charting in a timely manner as evidenced by reporting 2 or less hours spent per shift spent on charting and leaving at scheduled time, rather than staying late to catch up on charting. Nurses will provide effective nursing care as evidenced by thorough and accurate documentation of patient care, interventions, and outcomes. Strategies used to achieve goals include engage the staff by involving them in the development of policies for the electronic record. Before moving to the electronic record, revise the current paper flow sheet and get it fully functional so that staff is comfortable with it. Have experts review and record to make sure all required information is being collected appropriately. The record should also be up to date with quality measures specific to the patient population that nurses are required to document. Present a draft of the revised form to staff for review and encourage more comments and suggestions to improve the form so it can be appropriately and efficiently utilized. Have the staff use the revised paper record for a trial period, usually 90 days. Complete chart audits during the trial period for compliance, completion, and accuracy, and note any trends. Then incorporate all the changes and refinements into the paper form. Conduct a comprehensive computer skills assessment for each nurse. Determine which staff are computer literate and need training only on the electronic charting and which ones need basic computer training as well. A nurse with the average computer skills will probably need about 4 hours of training and perhaps more to learn the electronic charting. Training should be uninterrupted and well planned. Nurses may attend up to 4 training sessions to learn the electronic charting, and individual assistance may be given if needed. Then implement the full computerized charting program after the 90-day trial period. Operational indicators. Super users will be created and will assist with the chart audits. Chart audits will be performed weekly for the first month, and then every other week for the second month, and then once a month for 3 months. This will help to identify any areas of confusion and assess for compliance, completion, and accuracy. Evaluation form to be completed by nurses at the end of the trial period, as well as 2 months after the initiation of the computerized system. Super users and management will utilize these forms to make improvements and identify any problems or areas of confusion. This will ensure that staff needs are met and proper documentation is being done. The budget. Computers would need to be installed in all 22 patients' rooms and allow for bedside charting. A computerized charting system would be funded by the Women's Center IT budget. A wireless QS system could be implemented and ran off the system installed in labor and delivery. If Cerner was implemented, the computerized flow sheet aspect of the program would need to be purchased as well as updating the computers. Programs available would be QS or Cerner, or staff may choose from a different program. QS will most likely be beneficial to the patient population in the Women's Center. The postpartum nurses may access information during the patient's labor and delivery. Some nurses are already familiar with QS, which could ease the transition and incorporate charting aspects for postpartum and GYN patients. Implementation. At this time, nurses and other staff will be informed about the switch to computerized charting. Management as well as IT will present the information to staff during mandatory staff meetings. Conduct a trial period of 90 days and use the selected flow sheet in paper form. Assess computer skills and provide necessary training by super users and management to staff. Conduct chart audits. Obtain feedback from nurses and address any needs or problems. After the 90-day trial, initiate the computerized charting system. Provide super users during all shifts to assist staff during the first week. Evaluation. Self-evaluations will be completed by nurses at the end of the trial period and 2 months after initiation of the program, and they will help to identify areas of improvement or change. Since the nurses will be utilizing the program each shift and on every patient, it is important to acknowledge their concerns and thoughts. Chart audits will also be used to evaluate the effectiveness of this program. Repeat chart audits at 6 and 12 months after the implementation of the program. Appendix A is shown, and that is what was utilized to collect data from the nurses. Appendix B is the evaluation of the computerized charting system from the nurses. And Appendix C is the evaluation of goals and how the overall program was successful. Thank you.